Hi, I'm Nita McEvoy, and this is Ageing Disgracefully with Dr Keiron Lord. Welcome to my podcast today.
Thanks for having me.
Thank you for coming along. You've travelled a long way from Manchester, Lee, from your clinic. So, Dr Lord, tell us a bit more about yourself and what you do.
So I'm a regenerative aesthetics and longevity doctor alongside my role in the NHS. I've been doing aesthetics for around 10 years now and started incorporating the longevity space into that over the last 2 or 3 years. Started off in the NHS, junior doctor, like a lot of you all start junior doctor, and at the time it wasn't particularly well paid, therefore it was either do extra locum shifts at the weekend or start in the aesthetics industry. And being completely honest with you, that's how I started. It was all about doing a bit of extra and earning a bit of extra money. That's how I got into aesthetics, and it just kind of built up from there. I carried on working in the NHS alongside doing the aesthetics. The aesthetics industry started taking off and my business started taking off, but I still do the NHS work now. I've done a few different roles in the NHS for years. I did acute medicine, I did A&E for 12 months and other things, and then I started working in obstetrics gynaecology, which is where I sort of found my niche, and that's where I've carried on working.
So are you, well, I've watched a lot of your podcasts, so you are a specialist in menopause in aesthetics, which we'll come on to shortly. But I wanted to ask you something, because I watched your story a few days ago. Do you actually deliver babies?
When I'm in the hospital, yeah.
He gives life, everyone.
It's not.
Calm down, ladies.
It's not. Honestly, it's one of the best jobs. And I think when I was working full time in the NHS, I was at burnout point. It was a lot of stress. Yeah. And the job is still stressful, but the actual bit of running around labour ward and things like that, it's a different sort of stress, and you can sort of thrive off the stress. So I do really enjoy that.
Exciting, I suppose.
Yeah. So now I still do maybe 1 day a week, and I just enjoy it. It's just you don't get that enjoyment or that buzz from any other job that I have or have had.
So do you think you'll always stay in the NHS? You'll have some time in the NHS always and stay there?
It's actually harder. It'd be the easiest thing in the world, and people say to me all the time in the aesthetics world, why are you still doing the NHS? Why don't you leave? Surely, financially, surely ease of life, everything will be better if you weren't doing the NHS job. I said, yeah, but I'd miss it. And it's harder to stay in the NHS than it is to leave it. If I go and do shift work now, the amount of work you have to do in terms of your portfolio, in terms of proving that you're still competent in that role, even though I'm doing 1 day a week, is a huge amount. So I've got to, between now and December, I've got to get 20 bits of feedback from patients in my NHS role so that I can do my appraisal. So I have to go and see somebody who's worried she might have had a problem with the baby or she's bleeding or whatever, and I go, oh, while you're here, do you mind just doing the QR code and giving me some feedback?
Oh, no.
So it's honestly, working in the NHS is harder.
You've
Financially,
got all that paperwork to do as well. Yeah. It's not just
a lot of paperwork, a lot of appraisal, a lot of revalidation. Financially, because you're working and getting a PAYE rather than being fully self-employed. Yeah. So I don't think there's many benefits to it other than I just really enjoy the job and I'd miss it if I didn't do it.
I suppose the NHS is like a family, isn't it? You've got all your colleagues. It's a whole community in itself, which aesthetics is a different world. Aesthetics is vanity, appearance, well-being. Yes, I know that you do well-being, but you've got an NHS and it's like people are counting on you, and that, I suppose that gives you a real sense of purpose for there.
I enjoy it, and I think I still work at the same place I've worked at for about 6-7 years. Work at the same hospital, know all the people there, been working with them for years. They've trained me, so it's nice to stay there and go back and see them.
So many years ago, I trained with Environ Skincare, Dr. Des Fernandez, one of the pioneers of microneedling. And what we also incorporate with our microneedling, a program called Feed, Fortify, Finish, right? So you feed the skin and then fortify. I don't know which way I've got it round, but it was all about taking supplements as well. So not just applying it topically to the skin, but to supplement our diet, because often we're not getting enough. I know that's something that you specialise in, is longevity, regeneration and supplements. So could you tell us a bit more about that?
Yeah, I think people get put off by words like longevity and stuff because it sounds a bit, but I think health optimization is a good description of it. Essentially, if you're looking at someone's skin concerns, you can be doing all the treatments you want in the world. They'll still work a bit, but if you've got a rubbish sleep pattern, you're sleeping 5 hours a day, you're scrolling on your phone at whatever time at night, your diet's terrible, you're drinking too much alcohol, and you're not optimising your body in terms of using the right supplements, it's only going to have a limited effect. So this is why I put the clinic together, to make it longevity and aesthetics, because you're going to get a better result if you're looking after your health as well as the skin. But the problem with the supplementation is there's so many out there and people don't know what to take, and a lot of the inquiries I get, often people booking for a consultation, and it might not even be skin related, it could be menopause related, it could be weight related, anything. And often, most of the stuff I talk about is just supplements. Let's think about the supplementation, let's think about diet and lifestyle, but supplements play a massive part in that. just telling people which supplements to take and why, and don't just go to online shops and buy one because it's the one that pops up or the one that pops up on Instagram. You've got to know what you're looking for and what you're taking.
So it's about the quality and the
quality, quantity, whether it's right for you, so men versus women versus stages of life. It will affect which supplements are going to be beneficial to you. Knowing which ones are useful, knowing which ones are good quality, how they're absorbed, things like that all make a big difference.
So as part of the Revive campaign, we're also working with the bodybuilding niche and extreme fitness niche. So in this sector, a lot of people take a lot of vitamins and then possibly do IV drips. But does everybody need everything at the same time with an IV drip? So it's about knowing that, and you have to bespoke it, right?
If you look at common over-the-counter multivitamins you get, most of them will say you get 3,000% of your recommended daily allowance of whatever vitamin it is. It's not. That's how much is in there because you're barely going to absorb any of it. So they have to give you 3,000% of it.
Oh, right.
Because you'll absorb a fraction of that. And so knowing which supplements are worth taking and not, and knowing which are going to be good for you, first things first is make sure you optimise your diet. If you can get good quality food, you're going to get a lot of the nutrients that way. Using things for the micronutrients or minerals, so things like your sea salt and things like that. People go, avoid salt. I had a guy last night talking when we were out, saying he had, yesterday afternoon, he was saying that he'd stopped taking salt, he stopped salt in his diet because of health reasons, and don't know the ins and outs of that, maybe he needs to, but there's certain, normal salt is just sodium chloride. Things like Baja Gold sea salt or Celtic sea salt have got 80 odd minerals in each one, so it may be you switch to that. Certain supplements, so certain things like vitamin D in the UK, as we know now, it's a nice day today, but most of the time we don't get enough sun, particularly in winter. NHS recently recommended that people supplement with vitamin D in the UK in winter.
Did, because that was quite controversial, wasn't it, around COVID time, that nobody wanted to make those recommendations because you can't just rely on supplements for everything. But now that they're...
Vitamin D is really important for a load of things, but for mostly it's metabolism of calcium and phosphate, which is involved in bones. And if your vitamin D levels are low, you can't lay down calcium in the bones and your bones get more brittle. Problem with that though, this is where it all comes into buying supplements and knowing which ones to buy. If you just take vitamin D alone, vitamin D3, it can be deposited in the wrong areas. So it can be deposited in your blood vessels, which can contribute to cardiovascular disease.
Oh, wow.
So if you're looking for a vitamin D supplement, you want one with D3 and a vitamin called K2, because K2 regulates the proteins that are involved in vitamin calcium deposition. So it's not just a case of going online and going, vitamin D, that'll do. You've got to know why you're taking it and which formulation you're taking.
Dr. Lord, I've got a really interesting story to share with you today, and it's about vitamin D and fertility in women as well, and you can tell me a bit more about vitamin D for men. But I was 34, and so at that time I was wanting to have a baby and it wasn't happening, but I was getting these really odd symptoms. My sight felt a bit fuzzy. I do a lot of close work with eyebrows, and my hands felt a bit weak, and I was just like, normally I'm as strong as an ox, why am I feeling like this? And we were trying to have a baby and it wasn't happening. And I then one day came over funny. So my client that day said, go into A&E because you look weird, you need to go, I'm not going to sit here and let you carry on like this. So I went in, and funny enough, they did a blue light transfer to UCLH saying that they've got a 34-year-old woman in and she's got signs of, is it a TCA stroke? Yeah. They took me over there. Oh my God, I was so frightened. I went, and everything was fine. They kept me under and then referred me back to the GP. The GP did another blood test, and literally within days of that blood test, he wrote to me with a prescription in the envelope to say, you are severely deficient of vitamin D. Here's a prescription. Can you take it straight away? And we want you back in 4 weeks to assess your blood levels. I was so shocked, but I don't know if I've got quite a responsive body, but as soon as I started, within 10 days to 2 weeks, I felt like everything cleared up, the vision, the strength in my hands, I felt fine. That particular day when I came over funny, even my speech was a bit funny. I felt like my brain and my body wasn't aligned. And thinking back on it, I was running a concession in a basement and I was working all the hours. So I probably wasn't getting enough sunshine. I'm a bit darker, so it's harder for me to convert to vitamin D, and that's what happened. And guess what, a few months later I was pregnant with my Georgia. So can you just tell us a bit more about that with fertility? Does it make a difference?
With any fertility is multifactorial. There's lots of things that contribute to it. So there's not a simple fix. It's not a case of, your vitamin D is low, take vitamin D, therefore you'll be more fertile. But you've got to be, your body's really, to optimise that, your body should be optimised and be healthy to make it more likely that you'll be pregnant and it'll be maintained. That's not just taking a supplement, but that's to make sure your diet's good and things like that as well. Think about it from an evolutionary point of view. It takes a lot of energy and a lot of work for your body to grow a pregnancy. So from an evolutionary point of view, is it going to put that effort into it if you're not in the right environment? If you're going through a period of starvation, if you're going through high stress, whatever, it's less likely to work. So I don't think there's a one size fits all. It's not like take vitamin D, but optimizing your health in the lead up, men and women, in the lead up to trying to get pregnant can be really beneficial. The amount of women we used to see in fertility clinic who'd come in, been trying for 12 months and no luck. And usually the women have done everything they can to optimize. I've stopped drinking, I've stopped smoking, I'm doing this, I'm doing that. Right, and what about your husband? Oh, well, he works away 3 days a week and things like that. And he's got a really stressful job and he stays in hotels and he eats hotel food and he drinks a couple of pints every night. And then they do the sperm testing on the men. It's the men. Because their lifestyle is off. And actually that has an impact on their sperm production. So a lot of the time infertility issues can be down to lifestyle and often can be not on the women, it can be the men.
So in fact, the sperm test can change quite often. It can change from 1 week to another. So if you are trying, the guys have to also make sure that they're taking care of themselves as well. And going back to the vitamin D, just last question about this, it can present itself in funny symptoms because I obviously they rushed me to UCLH for this. It was quite a scary time, but the symptoms that I had were really strange. It wouldn't occur to me naturally that actually I might be deficient in a vitamin.
There was something, I don't know who said this, there was somebody on, a doctor or something in America that basically said, we need to stop thinking about vitamin D as a supplement and think about it as a hormone. It's central to the calcium phosphate metabolism. It does work on hormonal pathways. And so if you think hormonal pathways in our body are so complex, they're involved in everything, that if one of those systems is unable to work, it'll have a knock-on effect on multiple things in the body. So that's probably why you felt the way you did.
Wow. So if you are feeling a bit strange, to at least pop in to see your GP. It could be something small. As easy as that is to have a supplement. And
it's worth getting the blood work done if you feel it. If you want to take supplements, get advice anyway, because I think buying random supplements, 1, may not help, 2, could potentially do harm, and 3, could just be quite costly if you don't need them. I think if you get advice either from a GP or from a longevity doctor or something like that, or a functional medicine specialist around which supplements will work for you, there are some that I will recommend, especially if people come in menopausal or perimenopausal. Certain supplements I recommend are standard because they're going to help. For other things, it might be like with you with the vitamin D, they'd recommend doing blood testing. So it's always worth getting proper advice and considering blood testing if needed.
What are the standard vitamins you'd recommend during perimenopause, menopause for women?
So vitamin D is one of them. Vitamin D with a K2, just for that protection against the cardiovascular disease element.
Oh, right.
K3, as our estrogen levels decline, we get more inflammation in the body. More inflammation can present as various symptoms, but things like joint pains and aches and things like that. So omega-3 can help. Magnesium, really important. Magnesium is a supplement that helps with sleep, involved in various different processes in the body, and so supplement magnesium is definitely recommended. Thinking about which ones to supplement is important. Certain magnesium compounds aren't very easily absorbed, so using a magnesium product, ideally that's liposomal. Liposomal is a formulation that allows you to absorb it better. So those 3 are really important. Thinking about other things like the NAD, NMN type things, so they're a different thing altogether, but essentially they're the energy of the cells. So they could be supplemented in on top, but the first 3, vitamin D, magnesium, and omega-3.
So NAD and NMN are the thing now. So we're hearing a lot of conversations about that. And until we spoke last week, I didn't really understand it. I know that it's good for us. Myself and my friend Steve would take NMN. So NAD can you just tell us a bit more about that?
So NAD or NAD plus is a molecule in every single cell of our bodies, and it's essentially involved in energy production in the mitochondria. So the mitochondria in the cells are the energy factories of the cells, and it relies on NAD plus to allow that to function. As we age, the mitochondria get more tired, become less efficient, and we get less NAD in them. So with less NAD, you're able to produce less energy. With less energy, our bodies can't do what we were doing initially. So it's not very good at then repairing DNA damage. It's not very good at replication. It's not very good at producing the proteins and things we need for our cells. All those systems, all those functions become less efficient. And so the idea of supplementing back with NAD or NMN, which is the precursor, is that you put that energy back into the cells and allow your cells to function optimally, therefore reducing signs of aging, cell damage, etc. NAD on its own is the supplement that does, or is the molecule that does that. It's the energy producing component of the cells. You have other supplements like NMN that you mentioned that you take. That's the precursor. So your body makes NAD from NMN, and there's another one called NR, which is another precursor. If you look at, there's a guy in America, Professor David Sinclair, who's done a lot of work with NMN and NR. It's worth having a look at his work to see the evidence. NMN has been found to be more superior than NR alone, but if you're going to take, then the two in combination work better. And then it's a decision to make about whether you take NAD or NMN. So you can either take the direct supplement of NAD, or you take it as NMN, allow your body to make it. It kind of depends on your client or your patient. Instead
of taking vitamin A, you take beta-carotene, which helps your liver to convert right amount of vitamin A for your body.
So if you're taking NMN, you could convert into NAD. However, if your cellular mechanics aren't working effectively or efficiently, then are you going to make it? So it's a case by case, but there's certain things to look out for those. Again, any supplement, don't just buy what pops up on Instagram. A lot of companies will claim we are 99% pure. It helps. When I say it doesn't matter what purity it is, obviously purity matters, but it could be 100% pure, but if you absorb none of it,
it's useless.
You're just passing it through. So really look at the way it's being delivered, whether you're doing it as an IV drip, whether you're doing it as a tablet, whether you're doing it as a liposomal supplement. So liposomal NMN is really good. There's a company that does it and you use a drop under the tongue and you can absorb about 90% of it in 90 seconds. So if you're somebody who doesn't want to take a drip all the time or an injection, then liposomal drops are a good option.
I think that somebody like my lifestyle, that would be better. Just sit there, have a drip for an hour. It's time consuming. Yeah. Some people like that because they feel the boost straight away, don't they?
I like them occasionally. Then you want your sort of ongoing daily maintenance. Yeah. And then when you are feeling a bit run down or you need a bit of an energy boost, or you might just schedule a regular monthly or 2 monthly drip, then fine, you can go and do that.
Great. So I have recently, especially in the past year, 18 months, I get a lot more guys coming in for aesthetics treatments. I don't know if you're seeing that as well. Before, they'd be getting dragged in by their girlfriends and wives. And what I've noticed is how many people are now having scalp restoration hair implants, and they're so successful. And how this has become accessible to people to have it. Before it was just like for the celebrities, and so many people are doing this now and aging disgracefully, pushing back on aging. Have you noticed that?
Definitely a lot more men coming in every year now. There's more and more men coming in for treatments, and I think as treatments are getting a bit more natural, probably the wrong word, isn't it? Because we are still doing something, but it's less about fillers and stuff. It's more about improving skin quality and things like that. So men are becoming more and more invested in that. Definitely hair is a massive thing for a lot of men and women, actually. Sort of losing hair in menopause can also be problematic, but a lot of men are going over to places like Turkey and getting hair restoration and things, and it's a great treatment. You can do treatments in clinic, and I think there's a gap at the moment where people are going, hair's thin, let's not do anything. Right, it's got to a point where I'm going to go to Turkey, and actually there's a lot of steps in between that we're not doing, which can actually help maintain that hair. Or if people are still going to have a hair transplant, what can we do to optimize the chances of that hair transplant taking? So treatments like exosomes with microneedling, you can use exosomes and microneedle on the scalp, which can stimulate hair production and stimulate those follicles to produce thicker hair. That can be done as a preventative treatment. So you can have that done if you're starting to notice a little bit of thinning in the crown or a little bit of thinning at the back. You could do that. Things like PRP also is an option. And it can either be done as a treatment to prevent hair loss, it can be done as a treatment for when you're starting to notice the first signs of hair loss, or any of those treatments can be done prior to having a hair transplant and then after the hair transplant. Because if you think about it, the reason the hair follicles aren't growing anymore is that scalp isn't in its optimal state to enable hair to grow. So why not do that before you have the hair transplant? Why not get the health of the scalp really good, so when you implant those follicles, they take and they're maintained, and then after the treatment, you can keep up with regular treatments of PRP or exosomes to keep that hair healthy.
So that's really great because, as you know, and you're involved with, we've got the Revive HS product that's come out, which is specifically for hair and scalp rejuvenation, exosomes with PDRN to stimulate that area. So essentially what you're saying is that we're building up that resilience, the condition of the skin, the environment for the hair transplant, to give it the best environment to have the hair transplant and to take and to maintain. So you're prepping your scalp and hairline. You're also doing the preventative, possibly curing some of the issues by nourishing the skin and then maintaining the result, because obviously it's more accessible, but you're still spending money to have your hair transplant done. So you want to give it the best possible conditions.
And the exosomes do work really well. So we've been using the Revive HS up at the clinic in Manchester, and we've got a hair specialist there who does a lot of these treatments, and the results have been really good.
Yeah. So you're actually launching a specific clinic for hair rejuvenation, hair and scalp rejuvenation. You've only been open 4 weeks, so you haven't spoken a lot about it, but Dr. Lord is he's going to have a specific clinic for hair and scalp rejuvenation, and we'll be running some more podcasts to talk about it more in depth. So that's launching soon, is it? You've got
this week actually is officially launched, and it's like every other aesthetic treatment we've been talking about. It's not just about doing a particular one treatment. It's not about here's some microneedling, that'd work, but microneedling, exosomes, polynucleotides, PRP, they all have a place in hair restoration. But also so do supplements, so does diet and lifestyle. And it's the whole. So it's about creating this sort of whole 360 approach to hair loss. If someone comes in with hair loss or hair thinning, how do we address that and what do we do? So that's what the clinic's going to be all about.
Lovely, that's great. How exciting. So we are going to have hair for longer as well. Not only look younger for longer, but that's the whole thing, isn't it?
It's a big psychological thing for people. Men who lose hair often struggle with that. And even more so often it's women when they start to notice thinning hair around menopause. It can be really upsetting for people.
I think menopause itself is grueling as it is, and then if you're losing your hair, you really feel like you're losing your femininity. So a good interesting question is, when you spoke about you've got clients that come in and they feel like overnight, I watched some of your podcasts, overnight they felt like, oh my God, I have just aged 10 years. How does that happen?
It's probably a cumulative effect of things. It isn't real that they've aged 10 years overnight, but lots of things are happening at once. And it does tend to be around that perimenopausal time. We've already mentioned the loss of collagen. So you've been losing collagen slowly, 1.5–2% per year for 20 odd years. You've hit menopause and all of a sudden in 5 years you've lost 30% of it. And the collagen is really important for the structural support of the face, for hydration of the skin, things like that. So you've lost that, you've lost the volume in the fat pads has dropped. You may also be experiencing thinning hair. You may be feeling older. You get a bit of joint aches when you get out of bed in the morning. You've not got the energy you used to have. Maybe your libido is not what it used to be. So it's those things all together. Now, often people will focus on one thing and think, oh, I look more tired all of a sudden. Overnight, I've just aged 10 years, I look more tired. Actually, that isn't it. You've been looking for something. Why do I feel, oh, it's that, I look tired, it's the eyes. But actually, it's everything else that's happening. And that's the whole point of doing this more holistic approach to aesthetics in the clinic, where people come in and actually say, this is the problem, I've aged overnight. Tell me about it. Tell me about diet, lifestyle, exercise, supplements. Tell me about what your symptoms are. Is it joint aches? Is it tired? Is it lack of concentration? Is it brain fog? Is it all that? That's what they mean. They don't mean I've aged overnight as in fine lines or wrinkles. It's just everything about the body. And there's ways of optimizing that and making them feel better again, but it just takes a detailed consultation and make a real plan for them. That's
quite interesting, because it's just made me think, I suppose by the time you're feeling like you're looking older, your skin is like the last place to show it, right? So it's all about your health, and instead of going for the symptom, you need to go back to the inside. And it's not just about you looking younger, it's about the overall health you'll be improving with this approach as well. So yes, we're having regeneration through aesthetic and vanity and all of that, but we're still having a whole health overhaul as well. We need to be thinking about that and keeping your health good. Just somebody that's healthy, that looks younger, more youthful, don't they? So
we'll have all had them clients, and I'm sure you will have. I have, and everybody who's listening and watching will have had them clients who you feel like they're never happy. You've done treatments with them, you've done a certain treatment, and just, I need a bit more there. Oh, my eyes haven't taken quite enough. And you see them and think, look at the after picture, there's no muscle movement in these eyes. If I give you any more toxin there, it'll make it look, they're the ones, actually, there's something else. So it's because they've put everything on, I'm feeling older because of how I look and it's this, and they're the ones that actually just take a step back and go, what's the main issue, what's the main symptom you're experiencing, and have them conversations about it, because they're the ones actually who, they're not happy, not because you haven't done a good job, but because there's more going on than just what's...
And that's the thing, isn't it? How you think affects how you feel affects how you behave, and it keeps going round.
Yeah.
How many days we're having a bad day, and we're having a bad day. I've woken up in the morning and I'm raging pre-menopausal, and I'm like, I need a nose job. I need my nose shaved down and all my problems will go away. And that's not the case, is it? It's all about being healthy and happy, and in your mind, everything needs to be invested in to have that overall happiness. And then you can walk into a room and you're in your tracksuit and it's like, you look really well.
Yeah.
So it's not just about the end vanity, smoothing that wrinkle out. Your health, how you're functioning, your sleep. So we're looking at the whole picture.
Yeah.
And that's why aesthetics for 2026 is going towards regeneration, longevity, looking at all the biomechanics as well.
A full 360 approach to aesthetics and wellness, and creating tailor-made plans for that client, for their concerns. It's not, I've booked in for 3 areas, here's your 3 areas, off you go now. It's taking a step back and looking at things a bit more holistically. And
that's really good, because there's also that, injectables, like, I don't want to have filler. No, you don't need to have filler. You can still look younger. There's so many other interventions. We don't need to go in and fill your face out or freeze it. You don't need to have toxins. You don't need to paralyse your muscles.
And if you do, more subtle treatments. Toxins, there will still be a place for toxins. All these celebrities who are having their fillers dissolved and going all natural, they're having fillers dissolved and they're having subtle fillers put back. So,
but improving the canvas, maybe.
Yeah. So small amounts of filler, small amounts of toxin, alongside regenerative treatments like polynucleotides, exosomes, microneedling. That's the way it's going. Alongside that, you're optimising the health, so that actually you're going to get better results overall, and you're going to treat the person as a whole rather than just treating the skin.
And looking good is about feeling good as well. And actually going on to that, what you and I discuss quite often is that how we're not using collagen stimulating treatments enough alongside our exosomes to rebuild the skin as well. And that is what I find personally one of the most underutilised treatments. And I know their sculpt is quite expensive, but there's lots of different products that do very similar functions, but we're not using them to be part of the anti-aging. That's not going to change how you look or change your characteristic or your natural beauty, but will reverse some of that collagen depletion and promote it again.
Yeah, and good thing with collagen stimulators is that they keep working. So I did some, they are an expensive treatment, and I think if you spent that amount of money on a filler treatment, you're going to see noticeable differences quickly with the fillers, but less so with the biostimulators. I think that puts people off sometimes. But I find when I first started doing them, I'd have a client in, she'd have one treatment, 3 months later or 6 weeks later or something, I'd see and go, do another one, and they'd go home, you wouldn't see them. But 3 months later, you'd see them, 6 months later, 12 months later, and each time they look better. It keeps working. And it's often a slightly more expensive treatment to start with. The results tend to last 2 years or so, with a single treatment in between, just as a maintenance every 12 months. So they do become more cost effective, and they are really underutilised and give a really nice natural sort of glow lift. And you'll see that what I noticed in one of my clients recently is the skin quality. I did a before and after photograph coming for a separate treatment 6 months later. I was like, well, you look really good. And when you look at the photographs, you can see the difference in the skin quality from before and after, which really wasn't what we were treating. We were trying to give a bit of a lift. But the whole skin texture, everything looks so much better afterwards.
And do you know what, that's quite good, because the thing is, I think in our lifestyles now, especially here in London, and you're in a hub as well, Manchester, it's all about aesthetic treatments, a lot more accessible, so we're having it done. And a lot of people want it in lunchtime, and they want it fast, they want to change. But if you truly want to capture the essence of beauty and want really good results, it doesn't happen overnight unless you're doing a filler, right? Yeah. And filler is not always going to make you look youthful if it's not done correctly. So when it comes to treatments, people need to give it time if you want really good, true results. Things like pigmentation, lifting that out, scarring, they take time, don't they?
Pigmentation,
having those expectations.
You go to the shop and they'll have a brightening serum on the shelf that'll get rid of all your pigmentation. It won't do anything.
No.
It is a long-term treatment, and that's part of the plan, but there's a lot of other things you need to be doing at the same time. But the analogy is like going to the gym, isn't it? You can be really good and go to the gym and have a really good workout for 2 hours, but if you're not then back there for another 2 weeks,
your biceps have not grown.
Like, what's it going to do? It's doing small things consistently, which are going to add up to make big changes. So if you're using biostimulators, exosomes, skin boosters, polynucleotides, any of those regenerative treatments, and you're going to continue to do that over time, then in 5 and 10 years' time, you're going to look back and you're going to have even better skin quality than you have now. And that's what you're aiming for. But the world we live in now is, I want results today. I want to see it now. I want to be able to order that thing and it'll be delivered to my house tomorrow. And I think people seem to use that approach to the skin, to aesthetics, and it's quite short-sighted. Think about the long game. Think about what you want to do in 5, 10, 15 years' time, how you want your skin to be.
And do you know what? That's just reminded me of another thing, that with skincare, because I've worked with skin, that was my niche, skin and eyebrows, and even cleansing and things, you need time and patience with it. A lot of my clients want to clean their skin. They're cleaning their pots. Everything, it's gentle, step by step. You cleanse, treat your skin with respect, treat yourself with respect, give it time, and it will all come, the results.
If you're putting products on your face that are causing a bit of irritation, or it stings or anything like that, or it causes anxiety, stop using that. It's about being gentle.
We're not here to bulldoze the skin. We want to work it to work in harmony with us, and we're teaching the skin to do something different, right? Yeah. Thank you so much for travelling down to London on your Sunday to be with us for Ageing Disgracefully with Nita McEvoy, and we will be dragging Dr Lord down for some more podcasts when he's free.
Looking forward to it.
Have you got your diary with you?
I've got my electric diary with me. I'll have a look. But yeah, Lord, thank you very much for having me.
Thank you.